Lupus Day, Top Doctors is joined by Dr. Clarissa Pilkington. She is a consultant in adolescent and paediatric rheumatology at Great Ormond Street Hospital in London. Dr. Pilkington has over 30 years of experience and is former president of the British Society for Paediatric and Adolescent Rheumatology and founding member of the UK Paediatric Systemic Lupus Erythematosus Study. She's dedicated to advancing medical knowledge in this area. Today, Dr. Pilkington will highlight signs and symptoms of lupus, ways to treat and manage the disease, and how important awareness of this sometimes fatal, certainly life-changing condition really is. Good morning, Dr. Pilkington.
Good morning.
Okay, so what is lupus?
So lupus is an inflammatory condition, so it's caused by inflammation that can affect any system in the body. So it has a huge range of signs and symptoms. I think the one that is most obvious is what's called a malar rash. So this is where you get a redness in a butterfly distribution over the face, and that's the one that is most often recognized by doctors. But it causes all sorts of other problems and it can affect internal organs, which is why it's so important to recognize it. So it varies from a very mild condition where you might get a rash and you might get some fatigue, some tiredness, and very little else, to a really serious condition that can be life-threatening. And of course, from that point of view, it's incredibly important to be diagnosed. In order to be diagnosed, doctors have to be aware of it and need to think about it. And that's one of the problems in certainly the pediatric cases, is that it's not as common as in adult women, and therefore pediatricians don't always think about it. But we have been raising awareness over the many years so that actually pediatricians are thinking about it more than they used to. And it's because its presentation is so variable, it means they need to think about it in lots of different conditions. So, this varies, as I said, from a rash, but it can cause problems with the nervous system. And so you can present with what feels like a psychotic state. And so actually even psychiatrists need to think about it. And the blood tests are incredibly important for actually diagnosing it. And one of the things that we have highlighted as a group to both actually GPs, so GPs are much more aware of this, as well as to pediatricians and other doctors, is a hallmark of the disease is something called anti-nuclear antibody. Now, this is something the body produces itself. It can be produced by having had an infection. So the problem is, though, it's quite a good screening tool. A lot of people will have it who don't have lupus. So though it's quite good to look for it and then to think, could this be lupus? The diagnosis of lupus is not dependent on the ANA. So it's one of those things where it's good to have it done to screen for the disease, but then you need to see somebody who actually knows about lupus to say, is this just that you coincidentally have the ANA in your blood, or is this something that actually there is something going on, that lupus is a possibility in your case?
Great. So let's see. Are there any other symptoms that people should look out for if they suspect that they or someone in their family may have lupus?
So the one that often patients come to me with is because they're feeling tired and are having odd rashes, and obviously not all of those are lupus, some are. The sort of thing that would really worry me, that I would not want anybody to sit on, is if you suddenly get a lot of bruising or bleeding from your gums, or sort of petechial rashes, so little purple spots arriving, because that would mean that your hematological system had been affected, and that you might have things like low platelets, which means you're more prone to bleeding and you don't clot as easily. And that obviously is something that needs to be treated urgently. It's not something you can sit on. So for me, anything like that, which suddenly comes on out of the ordinary, is really important to be aware of and not to sit on, and to make sure fairly quickly and get some blood tests done.
Okay, Great, thank you. So how does a diagnosis of lupus affect both patients and their families or friends' lives?
So I think the first thing to say is that because it's a lifelong disease and it tends to come and go, first of all, it's quite a shock to the family if it's a child who has it or a teenager. It takes quite a lot of time to come on board with the fact that it's a disease that isn't going to go away. We don't have a cure for it, so you are likely to be on lifelong medication, whether it's from something fairly mild to something more major. And that you are going to have to be visiting doctors and have regular checkups for the whole of your life. And so there's a bit of a grieving process for most patients and their parents about the fact that, you know, somebody has this disease that isn't going to go away. And then it's trying to learn about the disease in the context of each patient, because it's such an individual disease. It causes different problems in different patients at different times. And so it's learning how to manage it. And I think one of the things that patients find the most difficult is the fatigue, the tiredness, which is part of the condition and comes and goes and can get better with medication, but actually needs a lot of effort at trying to make sure that you can contain it, that you pace your life, that when you're feeling well, you can do more. When you're feeling less well, you need to do less. And the fatigue is often a very difficult thing to actually work out what is best for you to do and for the families and friends to help with. And also affect, you know, in children or teenagers who are at school or university, their ability to concentrate for long periods of time. So they might look very well, but then it's trying to get their teachers and those who are helping them with their education to realize that actually they might need a bit more time, they might need a bit more support, even though they're looking well. So because it affects you globally, it's something that actually all families need to come to terms with and need to learn about and learn how to actually manage the individual symptoms that patient has.
Great, thank you. So how is lupus treated and how can treatment improve patient well-being?
Right, so the cornerstone of treatment, if it's acute, are steroids. So steroids are very good at reducing inflammation throughout the body. The problem is they have side effects, and therefore we are very keen to use either as little steroid as possible or for as little time as possible. So we might often start a patient on steroids. Sometimes in very mild cases, you might start them on something called hydroxychloroquine, which is an anti-malarial drug initially, but was then found to be very helpful in lupus. And it has a lot of protective effects on the heart and the cardiovascular system. So there are lots of good things about it. And all the research has shown that actually patients who are on hydroxychloroquine do better. So most of us now say all patients should be on it. And in mild cases, that actually will control their fatigue, it'll control their muscle aches and pains, their joint aches and pains, it'll control their rashes, and they do very well. If you have slightly more severe disease, then I'd probably start a patient on steroids and hydroxychloroquine. And if the hydroxychloroquine isn't sufficient to control the disease, I'd be adding in what are called immunosuppressants. So these are drugs that are designed to reduce the inflammation within the body. Their main side effect is they can lay you a bit more open to infection. So there's a sort of balancing act, but in a lot of patients, they're very, very effective. If the disease has affected the kidney, which is one of the systems it can affect, you might move slightly faster onto stronger medications, such as azathioprine or mycophenolate. These are all immunosuppressants. And in severe cases, you might need intravenous treatment for a few months with something called cyclophosphamide, which has been around for decades, but is very good at controlling the condition, but you can only give a finite amount of it as it has side effects. And nowadays there are newer drugs which have been designed specifically. So one of the problems with lupus is the immune system is a bit too active, is a good way of looking at it. So some of the white cells, B cells in particular, which produce antibodies, are producing antibodies against yourself. So there are some medications that have been designed to target the B cell, and those have been very effective in a lot of patients. You can only give them roughly every 6 months, so it has to be done in combination with other treatments. There are other new treatments which are also targeting parts of the immune system. So as the immunology, the immune system and the way inflammation works has been understood better, there have been other medications that are targeting bits within the inflammatory cascade that are also have come into use, such as belimumab and other medications. And those are meaning that we can get on top of the the symptoms better earlier, and feeling better, having more energy, having less hair loss, fewer rashes, fewer muscle aches and pains means that you can lead your life more normally and do what you want to do. So it's important really to get the disease under control. And as I said before, the disease sort of comes up and down in waves like this.
Mm-hmm.
So what we're trying to do is to dampen it all down so that you can lead a normal life. Unfortunately, there is no cure. So that's the sadness that we have, and a lot of work is going in to see whether we can find a cure, but it's such a multi-system disease that I think we're many decades away from that. We are still much more likely to be treating patients and controlling the disease rather than curing it.
Right. Okay. So how important? I thought I was interrupting myself then. Please excuse me. How important is it to prevent or manage the symptoms then? And how can people do that? How can patients do that, or other people?
So it's really important to manage the symptoms and the problems associated with the disease, because otherwise you accumulate damage to the organs, and that's what you don't want to do. If you can use as little steroid as possible, that is better in the long term, because steroids themselves can cause damage. So the most important is to actually really work with your rheumatologist, or if you're seeing a nephrologist, to make sure the disease is under control. You're going for your regular checkups, you're doing the blood tests, so that actually everybody is working to get the disease under control, to limit damage and to prevent, flares or relapses, because those are the things that can damage you more.
Mm.
So I think the most important thing is the sort of trust with your doctor and the regular visits to your doctor, and making sure that you don't suddenly stop your medication, you stop going, you stop having your blood tests, because then nobody really knows what's going on and we don't know what damage is happening. So I think it's really working really well with your doctor is probably the most important long term.
Sure. In combination with working with your doctor, are there ways for people to help manage their symptoms at home via diet or lifestyle, that kind of thing?
Yes, so there's not a lot of evidence about diet, but everybody want them to have a healthy diet. If you're on steroids, then actually you have to be really careful to have a low salt diet, not to have a lot of fats in your diet, because you have an increased risk of heart problems. And so you want to limit the foods that are bad for laying down lipids in your body. So that's very important whilst you're on steroids. You also really do need to make sure you have enough calcium in your diet, so that you don't make your bones thinner, which really is a side effect of steroids again. So having a good healthy diet is very important, but it won't cure you. So it's an important thing to say. There is evidence that certain things are helpful in the diet, like omega acids and things like that. So just a good, healthy, balanced diet is the most important. I think from the point of view of the fatigue, learning how to pace yourself is very important, and having the support of your family and everybody else to help you with that. You know, if you're an enthusiastic person, it's very easy to do lots and then be totally overtired and not be able to do anything the next day, which isn't a good way of managing. I'm very keen that patients keep fit, because actually the stronger your muscles, the better they are to withstand any flare of the arthritis that you can get or the inflammation in the muscles, and actually it reduces pain. So I'm very keen on fitness, and sometimes I'll have a physiotherapist helping, and actually physiotherapists and occupational therapists can often help with the fatigue and the pacing and keeping as fit as possible and building yourself up. So the other very useful is a psychologist, because some people find it very difficult to come to terms with a disease that is lifelong, that can affect so many different systems. And often the psychologists are really helpful at thinking through that. And if maybe it's making somebody anxious, giving them techniques to deal with their anxiety, to cope with the anxiety and lessen it. And some patients do get depressed, and therefore that needs to be looked after and treated as well. So a very holistic approach is the best one. And that's where family and friends are very, very important.
Absolutely. And so how important is World Lupus Day in highlighting this autoimmune disease?
So I think it's incredibly important, because it's the more awareness there is, both within the public and also within doctors and healthcare workers, the more likely cases are going to be recognized and diagnosed. And it's the undiagnosed patients who worry me, because they can come late and then it can be very difficult to get the disease under control. So I'm very keen to get this highlighted to everyone so that people are more aware of it. So things like World Lupus Day are very, very important for that.
Great. And finally, how has COVID affected lupus sufferers physically and mentally? And also in regards to e-consultations, how has that worked over this period?
So I think what we found is that the rheumatological patients haven't actually suffered more from COVID. A lot of the medications we use seem to, in fact, a lot of the medications we use have been used to treat COVID. So severe COVID is often treated with the medications we use. So that seems to have had a protective effect. Certainly in the children, we've found very few problems. They've had fairly mild COVID, and it hasn't been a problem for them. And they certainly don't need to stop their immunosuppressants. In fact, they actually seem fairly good at helping the symptoms and signs of COVID itself. I think the much more difficult thing has been with the pandemic, that people haven't been able to go out, they haven't been able to see their friends. You know, that psychologically has been very difficult. And so trying to keep fit and on top of your disease has been much more problematical. I think that's been much more of an effect. And then, you know, a lot of us had to go to only e-consultations, and some hospitals were good at setting up Zoom clinics, which means at least you can see somebody. And that means that the Zoom clinics, you can do a consultation where you can see each other, you can talk through the problems. The difficulty is you can't really examine. So I might be able to get joint range of movement over the consultation, but I can't feel the joint. And rashes are really quite difficult to see over Zoom. So from my point of view, somebody who's very stable, I'm very happy to do a Zoom consultation, or I'm happy to do a Zoom consultation. But if I can't quite see what's going on, or there's any hint that there's a rash that maybe a patient is worried about, then really it needs to be face-to-face. And the blood tests still need to be done. You can't do those by Zoom consultation, but we've often tried to have those done locally. There isn't so much travel involved. Zoom consultations have very much changed the face of medicine, but you have to be careful about making sure that you are still seeing the patients who need to be physically seen and examined, because you can't examine over Zoom.
Yeah, absolutely. It's a combination of both, really.
Yes.
Yeah. Okay.
Yeah.
Fantastic. Well, thank you very much, Dr. Pilkington. people that would like to make an appointment can visit her profile on topdoctors.co.uk. And once again, thank you very much.
My pleasure. Thank you.